what's really happening in the brain of someone who uses weed regularly and feels more anxious, unmotivated, and emotionally numb?
Wow, you really got directly to the point. Um, that's I think we have to step back and unpack it a little bit. So there have been a lot more studies done on the effects of cannabis and the brain over, in recent years. So this is a good time to talk about it. Um, Clearly, the effects that we've seen before with cannabis and anxiety, cannabis in relation to a motivational syndrome, the classic that they used to say with cannabis, we see that continuing. But one of the things that is a little different from before was part of this aspect of the chronic high potency THC brain. And that wasn't as prominent earlier, and now that's become quite clear. And so we can talk about what does potency mean and all of these things, but the aspect of like what's happening in the brain. So what's happening in the brain is perhaps not surprising, where we see impact on parts of the brain that the prefrontal cortex, for example, that's important for decision making. We see, in terms of, you asked about anxiety, um, the a brain region called the amygdala that's really critical for emotional regulation and a lot to do with stress reactivity, anxiety. We see, again, especially high potency THC will produce really substantial changes in this brain area, and the changes are exacerbated by stress. So it's this combination of high potency cannabis, stress that today, obviously, even more so in our society, and that combination impacts not even on only on how genes are turned on and off that they should be normally, but even the structure of the cells are changed in this brain area, and it correlates to even their impulsivity behavior. So it's really critical, I think, that um, over the past, well, I mean, it's still going on. We've come to recognize that there may not be like this one. When we talk about cannabis, the question is, what kind of cannabis are you talking about when you're talking about impact on the brain? Because even in our animal models, we were able to see, for example, adolescent THC exposure, the dose mattered on the effects on the brain and behavior. So, for example, adults that had low dose THC during adolescence as compared to high dose THC during adolescence, there's a big difference in their brain and in their behavior. And if we take like risky decision making and impulsivity, you saw that it's high dose THC during adolescence that impacted that. And it looked similar to what we see in human cannabis users that have a cannabis use disorder. So meaning it's your more chronic use of cannabis. So dose matters on the brain, and it matters on the brain in terms of also when cannabis is exposure occurs. But we see changes, again, like I said, in the prefrontal cortex of these due to high dose THC that relates to reducing the prefrontal cortical output. And so, again, that will impact on decision making, impulsivity, working memory, our day to day, and indeed this aspect of a motivational, behavior. That's a long answer, I know.
And for this conversation, I'd love to focus on like what people are doing today, like the high potency THC stuff that you've referenced. So how has like cannabis and what we've talked about, how has the potency changed over the years to give people an idea of how severe of a drug cannabis has become?
Yeah. So, when you look back, and a lot of times people think back of especially the hippie generation and so on, and THC concentrations were about 2 to 4% THC. And it continued to rise over the years. In the past 2 decades and today, you have regular street cannabis about even 15 to 24%. Think about that. But it's not just that in terms of the flower, the dried flower. You now have today, as compared to even 2 decades, 3 decades ago, you now have a lot of different products. So you have many concentrated products, the resins, the dabs, the shatters, that will give THC concentrations over 70%, even 90%. That is nowhere near a 4% THC that was, quote unquote, the normal that was being used. So it is not the same drug. Another thing is like the route of administration. We now, because of all of the different products, we now have, it's not just someone, and the teens like smoking, a bong here or, a joint there. It is there, the industry that have developed around cannabis is enormous. And so you have very manufactured products. You have that not just in terms of inhalation routes, but obviously also now the edibles. And it's not your brownie, it is these very, like I said, mass produced edibles, not just the gummies. There are so many different things, and all of that makes a difference. And it is incredible that you have such high potency THC. And when we talk about potency, we're talking about concentration, which means we're talking about THC. That's still the cannabinoid in this very complex plant of over 500 chemicals. That is the cannabinoid that is associated with the high, why people use it recreationally, and is also associated with, the negative effects that we see in regard to, psychosis or other negative aspects of that occurs that we see with cannabis. But when you increase the concentration of THC, you also increase its addiction risk. And today, we have people consuming cannabis daily or near daily. The increase daily, more daily of cannabis use has increased dramatically over the past decade, and it now exceeds that of daily or near daily alcohol use. So think about that difference in our society from just 10 years ago. So within that short time period, we've had this dramatic increase in the potency of the products, the variety in which you can consume those products, and the pattern of use. So the pattern of use of these high potency products has also changed.
And you think that people are shifting more towards cannabis versus alcohol because of the effects it gives, like the high, etc., over the fact they think it's less harmful than alcohol?
I think it's a combination. I think indeed the latter, like you said, that our society, there's this romance in one sense of that, cannabis was this anti-establishment kind of drug, and we know that, oh, the government lied to us, that cannabis wasn't this horrible thing, and now it's legal in most states in the US, so the stigma has gone down, and many people believe it is indeed of lower harm, alcohol. And don't get me wrong, alcohol and tobacco are still two substances that have killed more people in the US than cannabis. Cannabis is not, and people go as compared to opioids. You're not going to have overdoses with cannabis as you do with opioids. So people look at it in terms of the whole scheme of the types of drugs that might be out there for them to experiment with, that cannabis might be quote unquote safer. So yeah, alcohol has high mortality still. And I think because of this aspect of the destigmatization of cannabis, the legalization of cannabis, the fact that it's seemingly it has less, health issues. So that's why a lot of people are moving more towards that. But the data now is showing more medical issues with cannabis than we ever saw before. So, I think that we are in perhaps the same time of history when we, people were meant to think that, oh, tobacco was completely fine. Oh, it was, just, the movies, everybody is smoking, or, and alcohol is just, there's nothing bad. And then all of a sudden, as our society uses it more, you start to see all of the issues start to show itself. And I think that's what you're seeing more and more with cannabis.
I know cannabis. It used to be it stays in your system for about 30 days, at least on a drug test. If somebody is listening to this or watching this and they're now kind of motivated to quit cannabis, what changes would you expect them to see mentally, emotionally, even physically after quitting for just 30 days?
I mean, it does matter the amount of cannabis you've been consuming. So, Doug, it's not, like every other drug, it does take time to, it's not just leaving your body, but it takes time for your cells to, in a way, if you want to say, to get back to homeostasis, to get back to normal. But quote unquote normality may take a while, right? Because, like, as I said, depending on how much you've been smoking. So yeah, you're gonna go through withdrawal. Why? Because if you've been using a lot, you probably have a use disorder, even if you might not meet the clinical diagnosis of a cannabis use disorder. The reason you might be using it daily or near daily is that you've become dependent on it. So when you no longer have or consuming it, your brain cells are going to be like, wait a second, where is that? And you're going to start having cravings and withdrawal. And the withdrawal can be, many people don't realize, there are physical signs of withdrawal when people come off cannabis, including even sweating and so on. And they're like, oh my gosh, so be prepared for some of that physical changes. But in terms of the mental changes, people become very aggressive. They can't sleep. They go through, a lot that you may see with other substances when you go through withdrawal. Again, know that that is quote unquote normal. And it is your body, I'm going to say it's, end of the day, you're putting something not natural into your body. Even if people say, oh, we have a natural endogenous cannabinoid system, we do, but it's nothing like THC, nothing like cannabis. So it takes a while for the body to say, okay, I'm getting rid of this toxin. Those cells were flooded with this, and we need to, renorm to get back to normal. So give your brain and body a little time, even though it is challenging, because you're going to feel these physical things. You're going to feel these mental things. You're going to feel, many people will, always talk about consuming cannabis to alleviate their anxiety. But what it does is that it exacerbates the anxiety, especially high dose potent cannabis. And so now they're going to be like, oh, my anxiety is coming back, but it's because it was exacerbated by the cannabis use. So for me, I think during that time when you're feeling, all these very negative moods and the anxiety is going off the chart, speak to your physician. There are, medications for anxiety that can help you through this phase. Obviously, many people who come off it want to come off quote unquote naturally. There are, again, what do how do you fill the gap? Exercise, I'm not going to say that can cure anything, but filling, exercise, trying to get a better sleep structure, because all of those things are going to become impacted definitely during withdrawal.
But generally speaking, like how long does that process last, the withdrawal process? And then how long does it take for somebody to kind of start to feel like themselves again?
Again, it differs for different individuals depending again on how the severity of their cannabis use. People can even take 6 months, quote unquote, that they can feel not feeling You're not going to feel like the physical things into 6 months, but you'll feel still many people, not people, um, the cravings, the anxiety, even into 6 months. Now, this aspect of even individuals who may be at psychosis risk. So studies have shown if you're, low cannabis users, within a month or so, your risk for psychosis goes down. You might even need over 2 years of not being on cannabis if you're a heavy, high dose cannabis user and have a vulnerability also for your psychosis risk to decrease. So there is a spectrum depending on the level of your cannabis use. And also, as I said, if you might have certain vulnerability to certain psychiatric disorders, that can also change, how long it will take. But so think about this: how long you've been using will be a barometer of how long you might need to be off of it to quote unquote feel that you're back in control, that you're not needing this drug, that there are other things that you've been that are positive, that are other things that you've been able to do to give you back control over your brain, over your life, rather than cannabis, drawing you to use it.
And for people that want to quit and they want to do whatever they can to like minimize the withdrawal process, you said things like exercise, sleep. I know like community is important. Like, what are some of the other things that you would include if somebody's like, you know what, I want to do this the right way. I want to minimize the withdrawal process as much as possible. Like, what can I do?
I mean, I do think, as I said, if to minimize as much as possible, it is to work with your physician. I do think that people don't realize enough the huge physiological changes that that comes with having a cannabis use disorder. And so when you're, people, if you think about it, when you come off alcohol, right? People think about coming off alcohol, this huge withdrawal, or opioids, and they see a doctor, especially for alcohol. You can go, seizures and so on, and death with alcohol withdrawal. Other withdrawal, you're not going to die, but you may feel that way because you feel crappy. But there are things that, as I said, there are medications that are there that can help with the bridge, but you have to do that with your physician. I think getting also a good overview of where you are in your physical, like, uh, what does your body look like? When I mean by that, have a physical, have your doctor, give you what does your blood count look like? What does your vitamin, D levels look like? All of those things I think are really important. A lot of times people don't realize that, even though, most physicians do not know. Oops, I had something went off. I don't know that most physicians don't know how uh, to necessarily treat cannabis use disorder because there's no FDA treatment currently. But behavioral treatments, and when I say that, like psychosocial um, support is really essential. And psychosocial support, you don't need to only get from your physician, but there are a lot of programs that are through hospitals and so on. So that's why I said your physician can help in that way. But, you know, there, these behavioral treatments are actually very beneficial for cannabis use disorder. So even if there are no currently, like, pharmacological interventions for cannabis use disorder, to me, the fact that their behavioral treatments, psychosocial interventions are there. So make sure that you get that kind of help and support.
Right. And so it seems like it's not as simple as just flushing the weed down the toilet anymore, like what people used to do, right? And just forgetting about it. You need to actually go see a medical professional. And it also seems like the severity of the withdrawal process is like worse almost than like opiates. You know, you mentioned like a couple years, 6 months to like feel like yourself again. I mean, that's a long time, and I feel like that is something that may surprise people because they think it's just quote unquote weed. I've had countless people message me and reach out to me and they say, I can't stop weed. I can't quit. It's so hard. Like, why is it so difficult to quit weed other than its high THC content?
No, but that's one of the reasons why, because they purposely made people more addicted. And so you have changed brain circuits that are associated with reward. You change the brain circuits, as I said, anxiety. The Even look at the fact that today we have more individuals than we've ever seen that have cannabis hyperemesis syndrome, meaning, the vomiting, the nausea, and they have to go to the emergency room. This was not there before for cannabis. Now the emergency departments see so many people that have this, the cannabis hyperemesis syndrome. They see even more cardiac issues. So it does have to do with the high potency of the THC, not just for reward and the addiction and that they're feeling so crappy. The dose matters. We should be calling this a different drug. If it was the drug from the 4% THC, yes, there were individuals that were had vulnerability to certain things, but it's the degree of what we're seeing, of the medical issues, both not just psychiatric but regular medical issues that also are showing up. And so that's why the brain and body have been bombarded with these high potency THC. So, for example, our endogenous cannabinoid system is critical for maintaining homeostasis in both the brain and body. The cannabinoid receptors are practically in every organ in our body. Our endogenous ligands that bind to these receptors, they bind in like a key in a lock, but they do it in a mild manner. When something goes off in one biological system, they're there to help bring it back to normal. They maintain homeostasis. So now THC comes in. THC actually doesn't bind perfectly to that lock, but it binds with much greater tightness, affinity. And because the concentration is so high, it pushes that system far from what it would normally do in providing homeostasis. So it no longer is the brake. So when you have that much THC, think of that your mechanic now having to fix that brake problem. It's not it takes a while to bring that brake back up to normal. So that's why we're seeing that the withdrawal effects are so much more dramatic, because the endogenous, not only your endogenous cannabinoid system has been changed so dramatically, all the other systems that it normally regulated are also changed so dramatically.
And there's like stigma around quitting it too. I mean, I can't tell you how many negative comments I've gotten when I post stuff about like anti-weed, but yet if you were to post and telling people to quit heroin or to quit smoking crack or to quit like whatever, nobody would say anything. But when you post something about weed, people get so angry. Like, why are people like so hateful when you like press the weed button? Like, what is it about that subject that gets people so riled up?
I mean, there are different groups. I mean, there are groups, for example, I was born in Jamaica. So, Rastafarian culture, it's 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 a ritual, it's more ceremonial. They actually do not endorse high potency THC. And and so some people really believe that this is quote unquote medicine. So take your hands off my medicine. Others have become quote unquote addicted, and they do not want to acknowledge that or accept that. And so there's this anger still going back to like, this is not, why you, if I was, on heroin, that's one thing, but this is completely fine. And they can't see that they have an addiction. And yes, I agree, the stigma of cannabis has, changed that. But, the same thing, if someone has an alcohol use disorder, sometimes it takes them a while they're very aggressive, like, no, I don't have this, the intervention that people always talk about. It's the same thing that is there for cannabis. But because I think the history of cannabis in our society, I completely understand that some people push back. Um, and that, that it's a shame that we have this black or white aspect of cannabis. You know, End of the day, whether it's heroin, cocaine, or cannabis, the brain is the brain. What you put in it, just like your body, what you put in it does matter. And when people, if you think about what the natural cannabis plant had in it to today, what people are consuming, that they're defending, they have to see that it was a manufactured product that they're using that has nothing to do with what was there originally, that they're planting their flag into. It is not cannabis. So, yes, that's something I think our society needs to come to, to really educate people. What are you consuming? Is it cannabis, or is it something that has very high THC, very low CBD, which the natural plant actually in Jamaica, like the culture, like I said, with the Rastafarian culture, they looked at these plants and the concentrations. THC levels were like 2 to 4% again, and CBD concentrations were very high. The products that are used in the US, very low CBD, and all these other chemicals in the plants are very different from their original that was here. So I do think people need to educate themselves as to what are you putting into your body, and then also why. There is a difference between, I believe that plants can be medicine, hands down. We just have, figuring out like which components, because I do believe that in order to make things reliable, just like aspirin, we know it's the bark of a tree, but we're not taking a tree and every morning and making it ourselves. It's like we isolated the chemical that was we could reliably put in a tablet, and you could reliably know if you take this dose of aspirin, it should alleviate your headache by how much time and what the side effects are. It's the same thing for me in creating cannabinoid medicine. But some people want to have the quote unquote full plant. So still know what that plant is, and what is the proof that that actually treats whatever you said, the reason why you're using it. So a lot of times we go in and we use things for a reason, and we don't really understand that reason, even on a psychological level. What is it that we're really trying to do? If you just want to get high, then say it. If you just want to get high. But but there are a lot of reasons why the people who are the angriest and this, there's a reason.
Right. And normally the reason that they're doing it, actually, it makes that, them doing cannabis makes their situation worse, causes more anxiety, messes up sleep more, messes up your focus, etc. I know
And
like the
relationships.
and
And
your,
relationships.
yeah, I'd love to talk more about that. Like we've covered obviously how weed impacts the brain, mental health, etc. Like what are some other like overlooked ways that weed, specifically again high THC, cannabis can ruin someone's life?
Well, again, I mean, I do think that relationships, many people then, the relationships that they have change. And a lot of those relationships, because, they may then gravitate to those people who are using mainly cannabis, and, switch from the people who might say, oh, this is bad for you. And so they're living in an echo chamber where they're not seeing the negative health consequences. So the echo chambers really do matter. That's why I said, for me, saying that cannabis is black or white misses the point. And one of the things that, in terms of that can mess with their life, Again, in teens and young adults, the increased risk of psychosis is important to understand. And, there's always been this debate if that's true or if it's just genetics. And a number of studies now really provide strong evidence that it is real, and it comes back to, again, the potency. So, for example, take countries like in Scandinavia, Denmark. They never had a lot of substance use, or mainly it was alcohol. And cannabis came into their society. And as cannabis came into their society, you could see this increase in cannabis use disorder. But they also saw this increase in schizophrenia. You can't get an increase in schizophrenia in over like in 2 decades. And that matches the trajectory of cannabis use disorder. And again, age mattered. It was mainly men, so it was mainly males, I should say, and an age. So after age 26, there was not there was not or 26 to 30, there was not an increased risk. It's, in males, especially from like 16 to 26, where that risk increased. So it is important to understand that the developing brain matters. One thing that we also see, like myocardial infarction, again, that wasn't something that was seen very much earlier. And now you're seeing more cardiac issues, again, more young men. So there is an aspect of having early heart issues has potential lifelong consequences. We don't know yet, because this is another thing. There are new changes in these products. We have to wait even a few more years, perhaps another decade, to see what may be some of the long effects on health. But we see these things happening now. Will these things last into as people get older? Maybe. And that's one of the things, again, why do we have to wait for people to develop what we see coming already down the road? Because we saw this with other substances like tobacco, like alcohol. Why do we wait for young people's lives to be impacted and their trajectory of their lives change? So that's the thing for me.
Has fentanyl has there been cases of cannabis being laced with fentanyl?
I know, crazy. Why do people do that? I don't know why. It's so horrible. And yes, I know it's another way to make you know get people addicted quicker to something, to come try other substances as well. But yes, there people are mixing fentanyl and cannabis and selling it. And so that's another thing. um, where you buy your products matters. And clearly the legalization of cannabis helps a lot in that regard, right? Because if people buy their products from legal dispensaries, because even here in New York, we have a lot of stores that look like they're real dispensaries or official dispensaries, and they're not. But buying products from legal dispensaries reduces your risk of consuming things like laced cannabis products. Are all of the products that you may purchase in a dispensary, you know, the same as what's on the label? I mean, studies have shown not, but at least in terms of, the question of like aspects of fentanyl, contamination, that won't be there. But without a doubt, cannabis products, there are laced with, even if they're not laced with, like, say, fentanyl, their products, depending on the company or the product that you buy, you can see that the product that they buy, they could have mold, they could have heavy metals. I don't think people realize cannabis is a plant that not only does it suck up a lot of water, it actually sucks up a lot of metals from the ground. So depending on where it's planted, it has this amazing capacity, which is great for the ground running. Like, it's really sucks up a lot of heavy metals, and so that's something that people can consume without realizing it.
And I think in order for people to want to quit, other than hearing some of these negative health outcomes and how it can ruin, their life, like we've been talking about, they need to feel that life will be better on the other side.
Exactly.
Right. So how, like, what message do you have to give people hope that if they quit weed, like, how will their life improve over time?
You know, we see it. We see that, young people whose lives were really focused on the cannabis, they weren't even going to school, they were, even failing in school, they coming off cannabis, they're graduating, they're holding jobs, they're having healthy relationships, finding love in partners that it's not the central theme, is not the cannabis, not the drug. The central theme is about them. You see their physical change. You see, they enjoy other things. So that's another thing. You can start enjoying, life around you. Um, it's sometimes difficult, though, for people who do have a cannabis use disorder to see that. But finding something else meaningful in their lives, and then when they're off this, a lot of people, it's like, it's like, how can you say, like, you have this big window shade in front of you, you didn't even realize, and you just start to open up and you see wow, there's blue out there. Oh, there's green. You start to see all of the colors, and, that's there in our nature. And it's that kind of thing. It's giving yourself control. When you have cannabis use disorder, you don't have control. It's a fake control that you think you have. It's no different from other drugs. This, in the sense of you think this is you. It's not you. It's the drug. When you start to realize that you can make, you know, set goals in your life and actually move towards them, when you're not dependent on the drug, when you see, as I said, the relationships that you can actually have meaningful relationships. You can actually find joy. You can actually move. You can actually, you know, be in control. I don't know another way of saying it, but be in control of your life. That makes a huge difference. And that's what I hope for a lot of people, because we have seen it.
And what about brain structure? Like, I feel like, one of the old sayings was weed destroys your brain, and clearly it does based on what especially the high THC stuff, as we've talked about. But, like, can the brain actually, like, heal itself over time to get back to where it once was?
I don't know if it gets back to where it once was, because the trajectory has changed. Remember, even if it wasn't cannabis and something, you know, even positive things that happen in our lives, the trajectory changes. But it's like the brain does change. You don't have behavioral changes if the brain didn't change. The question is, and one of the things, and I say this, being a neuroscientist now for all this time and studying the effects of THC and cannabis on the brain, the one thing I know is that the biological processes in the brain that are changed, that are maintained by these epigenetic mechanisms. And I think in society now, everybody kind of understands it's used like so generically. But epigenetics means that it's not your genetics. It's not the DNA you inherit from your parents. It's how your genes should be turned on and off, and it's response to the environment. And the changes that cannabis induces, they're maintained by these epigenetic mechanisms, and these epigenetic mechanisms are reversible. They're reversible. So for me, studying the brain, I used to think, because we would see these long-term changes, like, oh my goodness, it's deterministic, it's over. It is not. One thing that the studying the brain has taught me, it is epigenetic, it's reversible, and you can help it. So the things that you just asked me, Doug, in terms of what are things that people could do, all of those things, having positive relationships, the exercise, the behavioral treatments that they have, that change behavior, you're changing your brain, you're changing these epigenetic processes. Again, you have control. You have control. And the more you can make those changes, the more your brain, it's not that the cells may go back to the same way, but they're going to go back to a way to give you the quote unquote seemingly normal behavior for where you are in your life.
I guess given the fact that the THC is so potent, you recommend like medical supervision. You don't recommend like people taper off. You would recommend people just go to a professional and then quit in the way they recommend.
Yeah, I think if you have a cannabis use disorder, it's important, I think, to, speak to your clinicians. But there's nothing wrong in slowly coming off things, but making sure that, like I said, it would be, best. And I know some people don't go to doctors. So, is it best to try on your own than not at all if you don't get to a physician? Yes. But I think the higher potency that you're using, if you have been diagnosed with a severe cannabis use disorder, it is best to work with a clinician to help you through that. And there also, as I said, behavioral therapy does have a lot of benefit. And so working with a therapist also is important as well.
Yeah. And there used to be a lot of talk that, we talked about this briefly, or you did, I should say, that, at least I'm not doing heroin. And people thought that it was a form of harm reduction was using cannabis. And from what I've understood, the research, at least from what I understand, clearly says that it's not, and that in many cases, what happens is they're adding that as another drug. What is what have you seen as far as the research and your stance on that?
Yeah, the research is mixed, and I think people started of, like there was an initial study that, oh, in the states that had the first states or so that legalized cannabis, opiate use went down, and it's not that. It was more complicated than that. It's like saying more people die from eating ice cream in the summers, but it's the summer that they're eating ice cream, and so more people, drown. People drown because of eating ice cream, but it's the summer, and it's like, so we see that have certain groups or certain individuals reduce their opioid use with cannabis? Yes. Again, it's going to come back to types of cannabis. We are even doing clinical trials because we started over a decade ago before cannabidiol, CBD was even so known to the public. We saw that in our animal models that it reduced heroin seeking behavior, so we started clinical trials. So using CBD, and we see more positive outcomes in terms of reducing craving and anxiety. We're doing phase 3 trials now to see if that, really does replicate in a large population, and we'll see if, that could be a cannabinoid that may be useful for treating opiate use disorder. But as you said, many people who have an opiate use disorder consume cannabis, and so is it really um, you know, is it a harm reduction strategy in part? Yes, because as I said, they're not going to overdose, even though we see, negative medical and psychological, psychiatric outcomes for some of this with the high potency THC. But I think many people still think that as compared to overdose with opioids, it may still be a better quote unquote harm reduction strategy. But it's not that they're necessarily replacing. A small subset of individuals will replace completely opioids with cannabis. But as you said, there's more, co-use of both of those drugs.
Right. I think like maybe logically it might make sense to people, but psychologically, when dealing with addiction, it doesn't, because you know that if somebody's addicted to one substance, they'll get addicted to another. And I also heard you say the evidence for where it's beneficial is with CBD, not with high potency THC, which I think is a very important thing to mention.
Yeah, absolutely. And that's why I come back to this aspect of education. And that's what you're trying to do. I know. Education of cannabis is not cannabis is cannabis. You have to know what it is. And cannabinoids are not everything is not THC. And so sometimes people will call, cannabis like CBD, and it's not. You have to make sure if it's CBD, or are you talking about THC and the other cannabinoids? But the other cannabinoids are still very minor cannabinoids, and they're not studied enough, and they're not sold enough to, like, get any indication. But there are people who will use cannabis, say, for sleep, but again, low dose. And so, will those people be, diagnosed with a cannabis use disorder? Most likely not. So, and that was where some people who had other psychiatric disorders started using, cannabis, also, like I said, anxiety. But as you start getting higher concentrations of THC, it then induced, more anxiety than it alleviated. So you got to know the cannabinoid, you got to know the dose.
Do you think it's time that we start classifying, again, the cannabis of today, the weed of today, as a hard drug, just like all the other ones?
I do think that there should be categories, and I don't know what the terms should be, but I do think there should be categories. I think that people should know what they're consuming and know that there's no way that if you're consuming a 70% THC, that's whacking your brain, to think that that's not closer to, the cocaine than it is to the old cannabis. That you have to realize that it's not the same drug. There is no way that we would say that for anything else. It is not the same drug. So we do need to have some different type of classification. Like I said, that's above my pay grade in the context of what that, should be. But we have enough evidence that these high potency products are detrimental to health, not just mental health, but regular health as well. And they have much more long lasting impact on the brain. So why are we not really standing on the mountaintops and shouting to make sure that people know that the cannabis that they're consuming, if they're consuming, that's not the thing for you. That's not healthy.
Right. And I know one of the other things that cannabis does, and we've touched on this, is it messes up your emotional health and it can stunt like your emotional growth. I know it has a strong impacts, as we talked about before, on the developmental brain. Um, is it possible to regain like emotional maturity and emotional health after quitting cannabis?
Yeah, I do think so. And as I said earlier, I do think that the brain has a capacity to, through these epigenetic mechanisms, to, it's quote unquote a new normal. I don't want to say brings you back to normal, because what's normal, even for all of us. But, you know, it, being off cannabis helps you to develop healthy relationships. And those healthy relationships brings with it positive emotional health, and I do think that emotional health does get overlooked. So I'm glad that you're trying to highlight this, and probably you can have other people on where you talk about emotional health, because I think a lot of people go into using cannabis because they have certain emotional issues. So that's why I said earlier, why did you start? Understanding that kind of helps you to figure out, how do you even solve it without the cannabis now? So coming off the cannabis to really give yourself a chance to really have strong emotional health through positive emotional relationship, not only with others, but with yourself. So a lot of people are numbing the thing that they were trying to, they think, you know, get closer to, but they numbed that. And numbing never heals. So it's like, when you get Novocaine, as the Novocaine wears off, the pain comes back. And you then would take the Novocaine again. But and what it's numbing is not, does not solve the problem that you had, and cannabis numbs that. And so I do think that understanding why you went into it helps you to get out of it.
It's a two-edged sword. Like I think for me, I started to smoke weed when I was a teenager because it numbed all of my emotional pain. took all my problems away. But then shortly after, it just made everything worse because I was never able to get as high as I could or numb the pain in the way that I did the first time I used it, which I think is also something important to
Exactly.
say, that the the amount of alleviation you supposedly get just deteriorates over time, right? Because of tolerance and because you become addicted to it.
Exactly. Because you changed your endogenous cannabinoid system that was, helping with all of that. Yeah.
And then it just, it just hijacked my brain. And then I thought that the more I smoked, the more it would help me, and that I needed to smoke more to get that same feeling. But really, it just created a whole other subset of problems, which I've talked about extensively. And I just think that's the part that people miss is, and that's why I think you brought up you brought up an important point. It's like, if you don't want to get high, just say it, but don't come out and say that it's this solution for anxiety, sleep, depression, etc. Because that's not true. Like, if you want to just get high, just be honest and say that. But I just don't like the message that's being spread now, where you have people that, because they enjoy getting high off of weed, they now are just saying, oh, to rationalize and justify my behavior, I'm going to come out and say it's healthy.
Exactly. And this thing about healthy, even for medicines, that's the thing. There's nothing on this planet that we've seen so far that doesn't have side effects. That's why, the medicines that you see the commercials on TV, they will always give you 20 billion, like side effects in the end of the commercial. And they used to talk very fast and go through all of them. There is nothing. And it's not because those were made by the pharmacy. There is nothing on the planet, because it's called dose. And as you increase dose, again, cannabis is no different. You're going to increase all these negative effects. And so all of the things that people say, oh, it helped my anxiety, it helped my depression, like you said, all of those get worse over time. So it might have done it in the beginning of the low end of your cannabis use, but you've gone way past that. And that's what I mean about control. People think that they're in control, and they don't realize that they've lost it a long time ago. And that's the thing. So how you go into using it is a big reason why you stay trapped in it, and also helps to give you insights of how you get out of it and what you need to work on when you stop using cannabis. What do you, to honestly look in the mirror, what was it that brought me here? I'm now numb I was numb emotionally. You're going to still be numb after. In fact, it's going to be worse, because the endogenous cannabinoid system that was important for regulating your anxiety, your mood, and all of these things, your hedonic state in some parts, that's now off keel. That homeostasis balance that it had, that break, is now off because of the chronic cannabis use you had. So you have to now get back to the thing that you were trying to get away from when you started. And that's important.
Last question I have is, like, what constitutes like addiction in cannabis? Is it dependent on the dose? Is it dependent on frequency? Like, how do people like diagnose whether or not someone's addicted to it?
The diagnosis for cannabis use disorder is like for every other substance use disorder. It comes back to aspect of, the control you have over the drug. It comes back to the issues you have with life in terms of the relationships and, other things that you have. So it's meeting like these like 11 criteria of your capacity to live life well. And do you crave the drug? Do you have withdrawal symptoms from when you're not using the drug? So they're clinical diagnosis. So it's not a made up thing. It's just for every substance use disorder. So frequency and amount of cannabis use contributes, yes, to being diagnosed with a cannabis use disorder. And the more cannabis you use, you then will be you can have a increased chance of developing. You go from a mild cannabis use to moderate cannabis use disorder to severe cannabis use disorder. But I'm going to say one thing as well. We also know that there are individuals who do not meet a clinical cannabis use disorder, but they still show issues. Even the young people, they show issues academically, they show issues emotionally, they show issues still. So even if you don't meet that and you're consuming cannabis frequently enough, they now call it like non-disordered cannabis use. It's like they don't, this term. You can still have an issue that impacts on health and other outcomes.
Well, Dr. Hurd, this has been awesome. Thank you so much for coming back on the podcast.
Thanks for having me again. Good luck, and thank you for your messaging.
Oh, you're welcome. This has been amazing, and I'm really glad you came back on to educate my audience even further on such an important topic.
Thanks. Thank you.